We are here with our health commissioner, Dr. DeRaza, and our partner, Bmore for Healthy Babies, to uplift and celebrate the significant decrease in the infant mortality rate in the Upton and Druid Heights neighborhood. That's something that we should be proud of. Let's give ourselves a round of applause. We're also joined by Dr. Bruce Jarrell, President of University of Maryland, Baltimore, Damon Milliard, President and CEO of the Family League of Baltimore, Tracy Kodak, the CEO of Healthcare Access Maryland. I don't see Destiny. No? She's on her way. We will be joined by Dr. Destiny Ramjohn, Vice President, Human Health and Social Impact at Care First Blue Cross Blue Shield, Stephanie Stevens, Director at Bmore for Healthy Babies at Promise Heights, and Antoine Dow, who's inside cutting hair, owner of Cut Styles Barbershops, where we are here today in East Baltimore. It is no secret that there is a significant racial disparity in infant mortality, with black babies typically dying between 2 and 5 times the rate of white babies. This is an unfortunate dynamic that our city knows all too well. Back in 2009, 15 out of 1,000 infants in the neighborhood of Upton and Druid Heights did not survive birth. This is heartbreaking, especially since these neighborhoods are almost all black. But these are more than just statistics. It's 15 lives that will never have a chance to reach their full potential, to watch Saturday cartoons, to eat crabs, dress up for Halloween, or go to Shake and Bake for a kiddie Easter disco. While the deck is already stacked against black children growing up in these neighborhoods, 15 of those precious lives won't even have an opportunity to dream or fulfill their full potential. But thanks to the great and the dedicated work of Bmore for Healthy Babies over the last decade, the infant mortality rate in Upton and Druid Heights dropped by 75%. Down to 3.8 deaths per 1,000 live births. This rate is comparable to the city's overall white infant mortality rate of 4.4 deaths in 2019, and comparable to Baltimore communities that are far more wealthy and affected far less negatively by social determinants of health. The work in Upton Druid Heights is absolutely incredible, and it involves community organizing, extensive outreach and education to organizations, schools, businesses, and pregnant and parenting people, group-based programming, case management, care coordination and linkage to services, extensive use of BHB communication campaigns and materials. I want to thank Director Stevens and Bmore for Healthy Babies for their surmountable impact in this community and subsequently in Baltimore as a whole. This is about equity and eliminating these disparities for good, so that all of our residents have an equal opportunity to not just survive but thrive, and all that our babies have the chance to be their greatest self. There is nothing more than seeing a smiling, happy baby on our streets in Baltimore, and we are glad that Bmore for Healthy Babies has helped us to keep more of our babies alive here in Upton and Druid Heights. I will now turn it over to Dr. DeRaza and our guest for a few remarks. Dr. D, and I'm going back to baby duty.
Good afternoon. Thank you, Mayor Scott, and thank you all for being here today. Today is a great day in Baltimore City as we celebrate the success of our Bmore for Healthy Babies initiative, which has achieved a record low infant mortality rate here in the Upton Druid Heights community. We could not do this work successfully without our partners. I'm pleased to be joined today by Dr. Bruce Jarrell from the University of Maryland, Baltimore, Damon Milliard from the Family League, Tracy Kodak from Healthcare Access Maryland, Dr. Destiny Simone Ramjohn from Care First, and Stacy Stevens from the University of Maryland School of Social Work Promise Heights Initiative. I also want to acknowledge the members of our own Baltimore City Health Department who've worked so diligently to ensure this program's success. Namely, I want to thank Rebecca Deneen, our Assistant Commissioner of the Bureau of Maternal and Child Health, who's been with Bmore for Healthy Babies since its founding, and Kathy Costa, our Director of Infant Mortality and Child Fatality Review. Rebecca, Kathy, and the entire team within the Bureau of Maternal and Child Health have been tireless advocates for youth wellness programs here in Baltimore City. This bureau within the health department, like so many in our department, have dedicated their time and efforts towards the elimination of health disparities in Baltimore City children and families. I also want to highlight the work of our community partners, individuals like Mr. Antoine Dow, the owner of Cut Styles behind us. We thank Mr. Dow and so many like him who work alongside our residents and show the importance of meeting people where they are in non-traditional spaces to foster impactful conversations. And finally, we could not celebrate today without the parents here who've contributed to this outcome. Yay. Like many jurisdictions, Baltimore is challenged by significant racial disparities in our infant mortality rates when we compare Black and white infants, with Black babies dying between 2 to 5 times the rate of white babies. In 2009, when Baltimore for Healthy Babies initiative was launched, the Upton Druid Heights neighborhood had a higher infant mortality rate than the city overall. As Mayor Scott mentioned, we were seeing 15 deaths per 1,000 live births. Now, after 10 years of ongoing engagement, the infant mortality rate here has dropped by 75%. Today's celebration of this record low Black infant mortality rate here in this community is a testament to the power of collaboration and sustained community investment. Bmore for Healthy Babies reminds us that public health interventions work and can improve health outcomes for all of our communities. The social determinants of health must be acknowledged in our work, but through education, outreach, advocacy, and engagement, they can be overcome. It is within our power to eliminate health disparities here in Baltimore, and Bmore for Healthy Babies shows us the way how, both here in Upton Druid Heights, as well as in Patterson Park Northeast, and all across the city. We look forward to our continued work building off of successes like these as we collectively strive to a healthier Baltimore, starting with the youngest residents among us. With that, I will now turn it over to Dr. Bruce Jarrell.
We got it backwards? Thank you, Mayor. Good morning and thank you. I'm not going to repeat everything that was just said, but I'd like to remember and recognize a couple of people. I recall when this grant really first came around 2009. We worked very hard with our federal delegation to get this grant, including Congressman Saunders. When we got it, we said there's lots we can do with this. And at the time, Dr. Renee Fox was the medical director, a pediatrician. Now we have Dr. Wendy Lane. Wendy, where are you? Here, who is the medical director. Dr. Bronwyn Maiden, who has led Promise Heights and all of this for a long time, and Stacy Stevens. Where's Stacy? There you are behind me. But this could not have happened with all of that. And I want you to all recognize the amount of energy and effort that they have put in to make this successful. I also want to introduce you to one other person who just joined us. You know, when I became president, it was right at the time of COVID, and we went remote. We went on Zoom, and I actually hired this wonderful person to lead the School of Social Work, Dr. Judy Postmus, having seen her for a half an hour. And she has been a wonderful recruit to our school, to our university, leading this, and we have great expectations. Now, you've all heard the statistics. When I talked with Bronwyn, I said, well, who's better in the nation than we? And she said, well, there's 2 little places up in New England, one little place in Massachusetts, a wealthy white community, and one place, where was it, New Hampshire? Yep. New Hampshire. And that's it. And then we're at the very best part of this list. So this isn't just an accomplishment relative to the rest of Baltimore. This is a national accomplishment where we have done a spectacular job. And when I've said to Bronwyn, what was the secret? She said, well, the secret was building trust, working with the community, and having the community make this happen. So we're all standing here before the podium, but who should be before the podium is the community, because you're the ones that have made this happen. Now, I want to echo one thing that the mayor said of these 15 out of 1,000 lives who never got to reach childbirth and therefore grow up. One of the greatest rewards of life, in my opinion, is being a grandparent and having grandchildren. So that means that several grandparents were also cheated out of this spectacular interaction with their grandchildren. So that was lost too. Two other comments. One, the hard part comes up now. Now we can keep the infant mortality down. How do we make it so that those infants now blossom, reach their potential, and become great contributors to this city? That's the challenge. So the other challenge is, of course, to keep our federal government helping us to fund this great program. And so, Mr. Mayor and all of our delegation, we're going to need your help to make this kind of funding, that is funding that goes to social determinants of health, really successful. So with that, I will turn it back over. Who's the Toastmaster? Damon is next. Damon.
Thank you, Dr. Giroux. So, Mr. Mayor, I was thinking about one of your former mentors, the late, great Elijah Cummings, our former congressman, who would say, our children are the future messages to a future that we'll never see. And so, Dr. Giroux, in terms of your message today, I think that that is quite poignant right now in terms of the strides that we're making. Family League of Baltimore is proud to be a great partner as a part of the Bmore for Healthy Babies strategy with the leadership of the Health Department, with the Health Commissioner, Dr. Duraza, and all the great team members. Healthcare Access Maryland, and also in terms of a robust amount of other partners who are at the table, including Promise Heights. Stacy Stevens, a shout out to you, my sister. I've been with you at Furman Templeton Elementary on Pennsylvania Avenue, and I see day in, day out in terms of the work that you do on the ground for our families. But I also want to recognize in terms of our home visiting partners, Drew Mandaman, Healthy Families have been committed to this community. Kimberly Hammonds, my sister, good to see you as well. Been committed to this work for at least 30 years. Mr. Mayor, in our role as a local management board, thank you for all the resources and support that we receive from the Mayor and City Council that we're able to invest in terms of the Home Visiting Healthy Families America network. That is an evidence-based practice that allow basically for home visiting partners and paraprofessionals to reach out and connect with overburdened families with some of the crises and the challenges that they're facing. It's not easy work, but those folks who do that work are our heroes, and we really want to express our appreciation for them today. We're proud to announce that we were able to leverage additional funding, almost over $1.4 million, Mr. Mayor, from the state, specifically to support Healthy Families America programs to leverage those resources for housing supports. So any participant that's a part of the HFA programs have access to that specifically for meeting the needs as it relates to housing. One thing that we do know, housing instability is also a key factor when we're talking about positive birth outcomes. One thing is, we're happy to celebrate today. It's a monumental occasion, but we still have a lot of work to do, because until we are in the position where the children in 21217, all right, that's a stone's throw away from Druid Hill Park, is the same birth outcomes as the children in 21210 in Roland Park, then we're going to be to the point where we're able to achieve true equity. So thank you for your time. I would like to call forward Ms. Tracy Kodak, CEO for Healthcare Access Maryland. Tracy.
A little shorter than you, Damon. Thank you for the opportunity to join you here today in addressing a key public health issue of infant mortality. Thank you, Dr. Duraza, for continuing to make infant mortality a priority in Baltimore City. HCAM has been a partner of Bmore for Healthy Babies since inception, and our role in centralized intake is a vital piece of this puzzle. We were founded in 1997 by regulation to assist Medicaid recipients with navigating the change from fee-for-service to a managed care model of Medicaid. Our care coordination program was created to serve as the safety net for Baltimore City residents needing assistance in navigating their Medicaid benefits. In 2004, HCAM became the single point of entry for all Medicaid, pregnant and postpartum referrals in Baltimore City, and ultimately transitioning to centralized intake when Bmore for Healthy Babies was formed. Annually, Somebody wants the podium. Annually, an estimated 6,000 pregnant and postpartum women and their infants and children on Medicaid eligibility in Baltimore City are served through centralized intake. Our outreach efforts, completed by care managers, social workers, and nurses, work one-on-one with each family to provide education, resources related to their Medicaid benefits, home visiting opportunities in the community, food insecurity resources, and safe sleep education. Our comprehensive assessment addressed other primary drivers of social determinants of health, such as transportation, housing, food, nutrition programs. Each individualized conversation is to ensure we are connecting moms and families to longer-term wraparound services. In this past fiscal year, HCAM's Safe Sleep team, during COVID, continued to deliver cribs, safe portable cribs, for their newborns to sleep to over 100 families. As a result of centralized intake, HCAM's care coordination team referred over 800 women to home visiting programs across the city to support their pregnancy. And our care coordination team provided almost 3,000 referrals to community resources during this most critical year of COVID-19. It is our core mission and legacy to engage hard-to-reach populations that have traditionally struggled to enroll and navigate their health care benefits. During the 2021 legislative session, Senate Bill 923 passed, leading to the expansion of Medicaid coverage from 60 days to 12 months. Yes. The expanded coverage is vital to support new moms and ensure access to ongoing health coverage, and we look forward to implementation of this benefit. We are proud of the role that HCAM has supported in the reduction of infant mortality across Baltimore City, especially closing the disparity gap between Black and white births. And I want to congratulate the Upton Druid Heights neighborhood for their significant reduction in infant mortality by 75% over the past 10 years. HCAM remains a key partner with Bmore for Healthy Babies initiative as we work towards reducing disparities in infant deaths, child abuse and neglect, and increase children for school readiness across Baltimore City. We are honored to be a partner, and again, thank you for inviting us here today. And I get the privilege to introduce the Vice President of Care First, Dr. Destiny Ramajan.
Yes, good to see you, Tracy. Thank you so much. This is a beautiful, beautiful, beautiful site. Destiny Simone Ramjan, proud to serve as Vice President of Community Health and Social Impact with Care First Blue Cross Blue Shield. We are honored to be a part of today's historic announcement. It's a milestone not just for Baltimore, but I think a model for local, national, and regional partnerships that seek to address health disparities. This is a record low for infant mortality, and the outcome is a direct result of more than a decade of local investment, community engagement, and education from hundreds of partners, but hundreds of parents too. I'm proud to stand here celebrating the transformational leadership of Mayor Scott. I want to also acknowledge the dynamic and data-driven team at the Baltimore City Health Department under Dr. DeRosa's leadership, Mr. Miller and the Family League, Ms. Kodak at the HCAM. Your work combined has been a transformational opportunity, and I applaud you. Care First has proudly made significant investments in Bmore for Healthy Babies since the very beginning, since 2008. For more than a decade, we've been supporting this massive citywide effort as the first, and we think the largest consistent funder. I hear a yes, so maybe yes. To date, we've invested about $12 million, and we want to do more. We absolutely want to do more. Our programming includes support of home visiting, prenatal, and parenting support groups, along with fitness classes and more. But why do we do this? Quite simply, we cannot afford not to. As a not-for-profit healthcare insurer, a leading employer, and champion for health equity, we know that to improve health among Black women and Black babies, we have to address three goals: improve outcomes, advance equity, and increase affordability. Infant mortality is one of the truest measures of a community's health status. But it's also a measure of the things that happen outside of your doctor's office, things like economic conditions and social conditions that influence health outcomes, like poverty, educational status, and the availability and quality of health services. We know that this isn't just an issue in Baltimore. America has a significant infant maternal care crisis. And as we think about today, we're putting Baltimore on the map. This is a national model, not just for health improvements and outcomes, but I think more importantly, an old adage that I like to say, nothing about me without me. As the other speakers have said, this cannot be done without tremendous community partnerships, and we want to see that continue. Thank you for having us here. We look forward to doing more.
Thank you. Good afternoon. I have to pause for a moment and say that we would not have been able to do any of this without the help of God, who has really allowed us to do the exceedingly and abundantly above all that we could ask, think, or imagine in this work called Bmore for Healthy Babies. I also want to thank my staff, my team, who has done a tremendous job of working so hard to accomplish this goal. And so thank you, Shasha Satchel, Celestine Tolliver, Angelise Shelby, Giselle Joseph, Meldon Dickens, and Blair Davis. And you have already heard remarks from Dr. Gerald about our fantastic leadership team. So Bmore for Healthy Babies at Promise Heights, our community-based program to improve family community health during the perinatal period, has established deep relationships with families, residents, and community partners. A central part of this work has been cultivating trust, mutual respect, and valuing community wisdom, which has resulted in the significant reduction in the infant mortality rate. We owe a tremendous thank you to everyone, but especially to Black women who partnered with us during the vulnerable but joyous time of pregnancy and parenting young children. During this period, we have deeply listened to Black women as you have transformed educational perinatal groups into spaces that foster social connections and supports. We admire how you have emerged as strong advocates and community organizers in your community, which has even led to new entrepreneurial and employment opportunities. You have been key informants of BHB's educational messaging and have shared how to effectively engage families. Thank you. We celebrate you as you lead and sustain this ongoing work. To our community partners, including faith-based organizations, home visiting programs such as Drew Mundaman Healthy Families, schools, education, early childhood providers, libraries, and housing complexes, thank you for sharing your strengths and invaluable resources to support this work. I want to make a special acknowledgement to the barbers. And we have several barbers in West Baltimore, and we're grateful. For 8 years, barbershops and barbers have been instrumental in providing space in their shops to share BHB messaging around ways to reduce the infant mortality rate, especially with fathers who are key influencers of women when they're going to receive early prenatal care, decreasing smoking behaviors, and increasing breastfeeding rates. You have emerged as safe sleep champions. Thank you. For 10 years, we spoke over and over again. We are here to ensure that every baby born in Baltimore was born healthy and was able to grow and live in a thriving family. This vision has become a part of the shared language of our partners. It is integrated into our educational materials. It has directed our strategic efforts and guided our partnerships. It has literally become a part of the fabric of our collective work. Public health sees the infant mortality rate as one metric to indicate community health. We have changed that into a mantra for family and community health and well-being, and it has manifested. 3.8 per 1,000 live births, the best in the city, and I'm gonna say the best across the state for cities that look like us, okay? And we have eliminated the disparity, and it's definitely worth celebrating. So as we celebrate this tremendous accomplishment, we know that this work continues, as many have said, as we set our sights on improving the lived environment and social conditions of the communities, which we know is the social determinants of health. But they interestingly intersect with racism. And so we must eliminate that, how it shows up structurally and interpersonally. Residents of Upton and Druid Heights shared their vision of a healthy community as being a community that is safe, beautiful, and flourishing, and one that supports their children thriving, particularly for Black men ages 13 to 24. This brings us to the thriving portion of Bmore for Healthy Babies' initial mission. Let's support residents as they redefine how we see equity, where it is defined by longevity and the quality of life. We will now hear from Mr. Antoine Dow.
Hey everybody, I'm Antoine Dow. I've been a part of this organization for a while now. Years ago, Ms. Stacy Stevens came to the shop, educated me on SIDS awareness. I had, at the time, my son was a preemie, so I was laying him down incorrect. And what she did was basically save my son's life by giving me the information about a loan on the back in the crib. So I'll just say this, we still have a long battle. I'm not gonna celebrate yet because I'm working with a lot of fathers right now who have new children. So I play the video diligently, play it as often as possible, and I also have to explain the importance of SIDS awareness. And also I gotta thank Quante Bulware. He's one of the young soldiers that's helping me push this forward at this shop, and I look forward to working with Bmore for some years, and it's an honor, and thank you, and I'll turn this over to Katrina. Miss Katrina? Sanaya Katrina? Katrina? No.
It's okay.
No problem.
Hi, everyone. Good afternoon. So I am one of the moms that Bmore for Healthy Babies supports. I'm 25. I now have a 1.5-year-old beautiful baby boy. And when I first, yep, that's right. So when I first was introduced to Bmore for Healthy Babies, I actually was homeless. I was house to house. I was in and out the hospital from stress. I was bleeding a lot. And Angelise would call me probably like once a week. And I was so stressed that I just would ignore her call, but it was for Bmore Healthy Babies. And it was until, I think you guys had a yoga event for moms. And when I went there, the room was packed just with pregnant moms, new moms. They had a room where they were watching the kids. They supplied dinner for us at the end, and I don't even think they knew that was the only meal I had that day, and I was pregnant at 8 months. And just from there, I stayed connected with them because I was like, wow, these people really love us, genuinely, wholeheartedly, from connecting me to birth companions so I wasn't alone in the hospital. I lost both of my parents, so to have extra aunts and uncles and people who are like, girl, I got you and your baby. I was like, oh, but y'all are for real. You know, so their support has just been amazing. They have postpartum classes. You know, you go through a lot of postpartum depression after you have a baby. From dropping off diapers, wipes, baby books. We have a group called Community Achievers where we are now creating new packages for new moms, so birth packages for new moms. So they are doing so much in the community. You know, not only are they saving lives, but they're building families. You know, fast forward to today, because of them, I've been able to start my own business where I help people with mental health. Yeah, thank you. Yeah, called Karina's Place. So without Bmore for Healthy Babies, a lot of people would just be SOL, and I'm so grateful. I'm serious. Listen, I'm so serious. A lot of people would be SOL. You know, I've been able to get my own place. I've been able to get back on my feet. And it's because of the support that they have given, not only myself, but a lot of moms and dads here. So I just want to say shout out to you guys and thank you so much for everything.
I've always wanted to say that at a press conference. Thank you. My staff is cringing right now. But I want to thank everybody for being a part of this. I mean, Madam Director, I think you said it very clearly. And when you come to our community, black community in particular, you can't do it without black women, and you can't do it without the barbershop. Because we know that the barbershop is not just where you get your hair cut, it's where you get your health advice, it's where you get your music, it's where you get your clothes, what to drink, what to eat, where the party's going on, what happened in the neighborhood, everything, your ancestry. So we have to understand the importance of working with valued community partners like our barbers. So thank you, and thank you everybody who was involved. But as we said earlier, this is just the beginning. We want to see these numbers improved in neighborhoods like Upton Druid Heights around the city, and we want to help folks in other places, but we want to now make sure that young babies like beautiful Casey there get to grow into their best selves by investing in them, not just now when they're a baby, but throughout the rest of their life. And with that, we'll take some questions, if anybody has any.
Hello. Is there a neighborhood this initiative is targeting next? Where is the organization taking this success?
Yep, Madam Director or Dr. Rebecca, come on. Should have kept the bag.
This initiative is actually citywide, but we have targeted neighborhoods. So we're in Patterson Park North and East, which also has seen an incredible decline in infant mortality. And we have the idea that these neighborhood supports can be expanded as much as possible, as much as the city will invest in and allow us to do. But citywide, there's messaging around safe sleep, there's work with home visiting programs, there's WIC, Women, Infants, and Children. All of these programs are working collectively together to bring about the best outcomes we can for the city. But specifically, we are always looking for new investment in new neighborhoods, but we are in Patterson Park North and East and Upton Druid Heights forever. We have invested in other communities, but in this level, this is unprecedented, and we're really looking forward to being able to replicate it as much as possible. But know that citywide, there are resources available, and the heart is number one for promoting the best outcomes we can for our moms and our babies, because that is that's what our city will be in the generation to come. So thanks.
Thank you.
Mr. Mayor, why not attend the town hall in Fells Point this evening, given your absence with the virtual town hall?
Well, again, Alexa, I know that this is what you guys are fascinated with at your station. But let's say again, last week when we had a official town hall with city agencies, I was at another community meeting that I committed to a month prior. Tonight, I'm going to be in another community meeting. We're going to continue to meet with communities around the city that are being impacted with violence and everything across the city. Thank you.
Do you plan to meet with constituents in Fells Point?
We meet with constituents from all over the city. Wherever we have incidents that happen, we're going to always be there. I wish you guys were with me last Friday night in West Baltimore, where they've had homicides and shootings consistently. Any other question?
I understand that, but do you plan to meet with them in Fells Point?
Again, we meet with constituents from around the city in and including Fells Point. Thank you.
Okay.
Anything else? Thank you, everybody.